Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Preventing MRSA infections. Community. Introduction. MRSA is a bacterial infection that is difficult to treat with antibiotics. MRSA infections are a concern in hospitals and healthcare institutions. However, MRSA can also spread in communities. Children are more vulnerable to MRSA than adults. MRSA infections at hospitals can be life-threatening. In the community, MRSA infections are usually less serious, however they can still be life-threatening. Washing your hands often and keeping bandages on wounds is essential in preventing MRSA infections. This program will help you and your loved ones learn how to prevent MRSA infection and recognize its signs. The tutorial also discusses the causes, diagnosis, and treatment of MRSA. Background info: bacteria and antibiotics. This section reviews important words and concepts that will help you understand MRSA infections. Germs are all around us. There are millions of them in the air and on our skin. Viruses and bacteria are examples of germs. Staphylococcus, or staph, is a type of bacteria. The MRSA germ is staph bacteria. Many parts of the body specialize in fighting germs. All of the germ-fighting parts of the body together make up the immune system. Sometimes germs can get past the immune system's defenses and cause infection and inflammation. If the immune system does not win the fight against an infection, the infection could spread to the blood and other parts of the body. If not treated, these infections could be life-threatening. Scientists have developed antibiotics to fight bacteria. Antibiotics are not good at fighting viruses. There are powerful antibiotics to treat bacteria, but they can sometimes cause side effects. Viruses and bacteria keep changing their structure through a process called mutation. Scientists call these new mutated germs strains. New strains of germs can become more resistant to antibiotics. If the new strains are more resistant to antibiotics, they become difficult to fight and more dangerous. MRSA is a strain of staph that is resistant to the antibiotic methicillin. MRSA. One type of staph bacteria is called Staphylococcus aureus. Some strains of these bacteria become resistant to the antibiotic methicillin. That is why they are known as methicillin-resistant Staphylococcus aureus, or MRSA. When a person has an active MRSA infection, they have symptoms such as an infected cut, sore, or bug bite. If the infection is not discovered in time, it could spread through the body, causing skin infections or pneumonia. It may be life-threatening if not treated successfully. Some people do not have an active infection, but have the MRSA bacteria on their body. These people are described as colonized and are called carriers. About 2% of people are MRSA carriers. MRSA bacteria are generally harmless unless they enter the body through a cut or a wound. Even then, MRSA causes almost no trouble in healthy people because the immune system fights it. People who have weak immune systems cannot fight infections as well as healthy people. That is why MRSA infections are more serious in young children, older adults, and sick people. MRSA infections can also cause more serious illness in people with weak immune systems, such as HIV patients and patients undergoing chemotherapy. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Transmission. A person can get infected with MRSA either from a person who is carrying it or from someone who is infected by it. The bacteria are spread by touching the person with MRSA directly or by touching something he or she touched. In serious cases of MRSA infection, the patient may develop pneumonia. Pneumonia is an infection of the lung. Patients with pneumonia cough a lot. Healthy people who get MRSA on their skin do not develop infections because healthy skin does not allow MRSA infections to develop. However, if there are cuts or scrapes on the skin, the bacteria invade the tissue and may start an infection. Scientists distinguish two types of MRSA depending on where the person got the infection. 1. Healthcare-acquired MRSA, which means the person got the infection at the hospital or another healthcare facility. 2. Community-acquired MRSA, which means the person got the infection in the community. When a person contracts MRSA at a hospital, it is usually more serious because the patient is already sick. In addition, hospitalized patients may have an incision or wound because of surgery or the insertion of a medical device in the skin. This makes it easier for MRSA to get inside the body and start a deep infection. Community-acquired MRSA is common in places where people get a lot of skin scrapes or wounds. Outbreaks of community-acquired MRSA tend to show up among team players of contact sports, such as football and wrestling. They also occur often in military training camps, prison, and in areas where children play in unsanitary conditions. Symptoms. Early MRSA infections are skin infections that produce small red bumps on the skin. These skin infections could become filled with pus and cause blisters that become painful. When the MRSA infection spreads to deeper parts of the body, more severe symptoms occur. Signs include fever, chills, headaches, rash, joint pain, and shortness of breath. These symptoms require immediate medical attention. Tell your doctor if you have these signs and if you notice any skin abnormality. Diagnosis. If you have MRSA or have had it in the past, tell your healthcare provider. That way they can give you the extra care you need and the right antibiotics when needed. To diagnose MRSA, your healthcare provider takes a sample from your skin or pus on the skin and sends it to the lab. Blood, urine, and other tissue samples can also be used. The lab technicians may use a culture to test your sample. This may take a few days. Treatment. Doctors prefer not to use antibiotics to treat mild MRSA that is not causing severe infections. This is so MRSA doesn't become even more resistant to antibiotics. For mild to moderate skin infections, doctors may first drain the skin abscess caused by MRSA. For severe infections, doctors may use an antibiotic such as vancomycin. Prevention. You can reduce your risk of MRSA by following these guidelines. Wash your hands well and often. Use hand sanitizer when you can't wash your hands. Keeping a bottle of hand sanitizer gel or foam with you at all times can make it easier for you to sanitize your hands at any time. Keep wounds and scrapes clean and covered. Avoid sharing towels, sheets, razors, clothing, and other personal items. When exercising at the gym or participating in athletic games, shower immediately after each game or session, wash towels and athletic clothes after each wearing, and don't share personal items. Not taking antibiotics as prescribed helps the bacteria learn to resist antibiotics. You can help prevent new strains of antibiotic-resistant germs by taking antibiotics only when necessary and prescribed by the doctor. Follow your doctor's or pharmacist's instructions when taking antibiotics. If the doctor wants you to take all of the prescribed pills, don't quit taking them just because you feel better. If you or your loved one is hospitalized, to protect yourself and your visitors from MRSA, wash your hands often and ask hospital staff if they have washed their hands before touching you. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. MRSA infection is a bacterial infection that is difficult to treat with antibiotics. MRSA bacteria are generally harmless unless they enter the body through a cut or a wound. Even then, MRSA causes almost no trouble in healthy people because the immune system fights it. People who have weak immune systems cannot fight infections as well as healthy people. That is why MRSA infections are more serious in young children, older adults, and sick people. Doctors prefer not to use antibiotics to treat mild MRSA that is not causing severe infections. This is so MRSA doesn't become even more resistant to antibiotics. For mild to moderate skin infections, doctors may first drain the skin abscess caused by MRSA. For severe infections, doctors may use an antibiotic such as vancomycin. You can reduce your risk of MRSA by following these guidelines. Wash your hands well and often. Use hand sanitizer gel or foam when you can't wash your hands. Keep wounds and scrapes clean and covered. Avoid sharing towels, sheets, razors, clothing, and other personal items. Thank you for using Explain.